alpha 1 present in the postsynaptic region. And location is peripheral blood vessels. In peripheral blood vessels, with stimulation of alpha receptor causes vasoconstriction. Alpha 1 present in peripheral vessels, smooth muscle, stimulation of that causes vasoconstriction. And in the iris, the radial muscle contracts with the stimulation with alpha 1 and causes vasodilatation. The agent that can cause stimulation of the alpha are different, but more specifically is phenylephrine. Phenylephrine can stimulate alpha by stimulation of alpha receptor. Stimulation in alpha 1 causes vasoconstriction in the peripheral blood vessels and constriction in the radial muscles in the eye causes mydriasis, dilatation of the pupil. An agent that can cause specifically alpha 1 stimulation is phenylephrine. This is called alpha 1. Alpha 2 present in the presynaptic region, specifically in the CNS, that causes reduced release of neurotransmitter. What is the neurotransmitter for autonomic nervous system? What is the neurotransmitter? Acetylcholine. Anything else? Adrenaline. Anything else? GABA. For adrenergic system. For adrenergic system, the neurotransmitter is noradrenaline, not acetylcholine, not adrenaline, not GABA. The neurotransmitter for adrenergic system is noradrenaline. By stimulation of the alpha 2, which is presynaptic in peripherally located, they reduce neurotransmitter release. That neurotransmitter is noradrenaline, reduce sympathetic flow, reduce release of insulin, and their specific stimulator is clonidine. Clonidine is a specific alpha 2 receptor stimulator. Then cause beta 1, where it is present. Beta 1 receptor present in the heart and in the JG cell. JG cell present in where? In kidney. Very good. So heart and JG cell. By stimulation of beta blocker, they increase heart rate, contractility, conductivity of the heart. So stimulation of the cardiac activity. And there is also another thing is, by stimulation of the JG cell, which is present in the kidney, if beta 1 present there is stimulated, there is a increased release of renin. Clear? So these can be stimulated by adrenaline, noradrenaline, but if only beta 1 stimulator is isoprenaline. Isoprenaline is only beta 1 receptor stimulator. Now beta 2. Beta 2 present in the smooth muscles. Where are the smooth muscles? Tracheobronchial tree, the blood vessels smooth muscle, which is deeper tissue. If it is peripherally, more superficial one are alpha 1. So smooth muscle of blood vessel receptors are alpha 1 and beta 2. Alpha 1 causes vasoconstrictor, whereas beta 2 causes vasodilatation. So other than bronchus, deeper tissue blood vessels, other than that GI and uterus, and all these, the smooth muscle, if beta 2 present, beta 2 if stimulated, what happened? There is no constriction, there is a relaxation, there is a dilatation. So relaxation of smooth muscle of tracheobronchial tree, dilatation of the smooth muscle in the blood vessels, dilatation of the smooth muscle or relaxation of the smooth muscle of GIT and uterus. Clear? In liver and skeletal muscle, they lead to glycogenolysis, resulting in glycogenolysis hole ki hobe? There is a increased glucose level in the blood, and there is also increased neurotransmitter release as well as increased sympathetic outflow. Beta 2 agonist is one of the beta 2 agonist is salbutamol. Salbutamol, they stimulate beta 2 present in the tracheobronchial tree. And if there is stimulation of the beta 2, what happen? The relaxation of smooth muscle of tracheobronchial tree result in relaxation of tracheo. If it can be used in bronchial asthma. Clear? Alpha 1, alpha 2, beta 1, beta 2, and which are the drug that is specifically stimulate only alpha 1, only alpha 2, only beta 1, only beta 2. Now beta 3, there is a result in lipolysis. Beta 3, no specific agonist but stimulation by adrenaline, noradrenaline results into lipolysis. All these receptors, alpha 1, alpha 2, beta 1, beta 2 is G-coupled protein receptor. Everyone ঠিক আছে? Next is where it can act and how it can modulate their action. Adrenaline primarily acts on alpha 1, alpha 2, beta 1, beta 2. There is a difference between the action of adrenaline and noradrenaline. Adrenaline can act alpha 1, alpha 2, beta 1, beta 2, but noradrenaline acts on alpha 1, alpha 2, beta 1, not beta 2, beta 3. Clear? There is no beta 2 action of noradrenaline. But adrenaline has a beta 2 action. Beta 2 action হওয়ার ফলে কি হয়? Where it present beta 2 present in the smooth muscle. কোথাকার smooth muscle? Location tracheobronchial tree, deep vein or vessels, তারপরে GIT and uterus. Clear? So adrenaline has a action of beta 2 action, but noradrenaline doesn't have. Clear? In CNS, adrenaline in clinical use there is no application or action in the CNS for adrenaline. In CVS, if we go for the heart is, what are the receptor present? Beta 1, and they causes increased heart rate, increased contractility, increased conductivity and increased excitability. তাহলে কি হবে এগুলোকে কি বলে? Inotropic, chronotropic, dromotropic and bathmotropic effect. All are increased by the adrenaline, and similar action can occur with the noradrenaline because both adrenaline and noradrenaline has a action on beta 1, heart beta 1. Next, in blood vessels. In blood vessels, there are two types of receptor. One is alpha 1, beta 2. So in alpha 1, by stimulation of alpha 1, that can be caused by adrenaline as well as noradrenaline. So that lead to vasoconstriction. Whereas for beta 2, if it is stimulated, it dilates. So there is a loss of or reduction of the peripheral resistance leading to fall of BP. Clear? But this beta 2 can be stimulated by adrenaline or noradrenaline or both. Only adrenaline but not with the noradrenaline. So only action of beta 2 that can also demonstrate by the vasomotor reversal of Del can be seen by adrenaline, not by noradrenaline. Then what is the vasomotor reversal of Del? Vasomotor reversal of Del কি হবে বলো? So if we pre-treated with the alpha 1 blocker, প্রথমে দিলাম, তারপরে যদি অ্যাড্রিনালিন দিই, there will be fall of BP. Why? Because alpha 1 is blocked, the exposed receptor is beta 2. So if there is a stimulation of beta 2, that there is a fall of BP due to vasodilatation. Clear? But is that similar effect can experienced with noradrenaline? No. So there will be no fall of BP, no rise of BP if a patient pre-treated with alpha blocker. If we give noradrenaline, there is no fall of BP, no rise of BP. Clear? So this is a phenomena, Dell's reversal phenomena. Reversal means ki এমনিতে যদি আমরা অ্যাড্রিনালিন দিই, there is a rise of BP, but if a patient pre-treated with alpha blocker, there is a fall of BP. This is the reversal of the death, and this phenomena demonstrated by only adrenaline, not by the noradrenaline. So by this phenomena we can differentiate adrenaline with noradrenaline. Clear? Now BP, heart rate, blood vessels, BP, blood pressure will increase both systolic and diastolic by the adrenaline as well as noradrenaline. Clear? Respiratory system, beta 2 bronchodilation, it can occur with the adrenaline. Is it occur by the noradrenaline? No, because they have no beta 2 action. Second one is decongestion of the mucosa. There is a term called anaphylactic shock. What is shock? Shock is a hemodynamic state where the peripheral organs, vital organs, unable to get adequate amount of blood. So what are the different types of shock? One is cardiogenic shock, heart pump করে blood পাঠাতে পারছে না, হ্যাঁ? Vasogenic shock, that means there is a peripheral pooling, so there is a inadequate blood in the heart, so they are not able to pump out heart, Neurogenic shock. Third one is septic shock. What happened in the septic shock? Infection, they causes vasodilatation of the vessels, so that heart is unable to get adequate amount of blood to pump out. Clear? The cause is infection. ঠিক আছে? আরেকটা কি আছে? Anaphylactic shock. In anaphylactic shock, what happened? The tracheobronchial smooth muscle, there is a IgE type of antibody that stimulate and release of edema in the mucosa of tracheobronchial tree along with the constriction of the smooth muscle. In these cases, alpha 1 decongestion can be done by both adrenaline and noradrenaline, but the bronchodilation part is not occurred with the noradrenaline. So drug of choice of anaphylactic shock is adrenaline, not noradrenaline. Explain why. In anaphylactic shock, why adrenaline is a drug of choice, or why adrenaline is preferred over noradrenaline in anaphylactic shock. কি বলতে হবে? In anaphylactic shock, there is a mucosal edema along with the contraction of smooth muscle of tracheobronchial tree. Clear? Smooth muscle mucosal edema can be counteracted by the stimulation of alpha 1 receptor. That can be done by both adrenaline as well as noradrenaline. But the smooth muscle relaxation that is caused by the beta 2 receptor stimulation, that cannot be occurred with the noradrenaline, but with the adrenaline. So we preferred adrenaline in case of anaphylactic shock. GIT, both alpha and beta 2 receptor present, and it is not clinically important, but there is a relaxation of the smooth muscle of GIT. In eye, the radial muscle, in the radial muscle, alpha 1 receptor present, mydriasis occur. Mydriasis means dilatation of the pupil. In skeletal muscle, beta 2, that can causes tremor and twitching. It is a side effect of salbutamol. We give salbutamol in a route. Which route? Salbutamol, tarbutaline. কোন রুটে দিই? Inhalation route. But if we give in oral route, salbutamol. Then what happened? There is a side effect of tremor and twitching of the hands and feet. So we preferred inhalational route than oral route. Why? Because if we give in oral route, they cause a side effect by stimulation of the beta 2 present in the skeletal muscle, causes tremor and twitching. So we prefer inhalational route for salbutamol in case of bronchial asthma patient. In metabolic beta 2 causes glycogenolysis, whereas alpha 2 causes reduced release of insulin, and both these causes resulting in hyperglycemia. Uterus will be relaxed by the beta 2. Spleen contraction is seen due to the alpha 1, which is clinically insignificant. Clear? The heart, peripheral vessels, then tracheobronchial tree, eye, uterus, metabolic, as well as spleen. Clear? In noradrenaline, the most important receptor is alpha 1 followed by alpha 2, then beta 1 and beta 3. There is no action of beta 2. There is no beta 2 action for noradrenaline. For dopamine, they present in they stimulate D receptor, dopamine receptor present in the renal vasculature. Clear? And beta 1 in moderate, and in the highest dose it can be also stimulate alpha 1 receptor. So in lowest dose, D receptor present in the renal vasculature. In moderate, D receptor plus beta 1 receptor. Beta 1 receptor present in heart. And in the highest dose, D plus beta 1 plus alpha 1. Alpha 1 present in peripheral vessels. Then dobutamine, alpha and beta 1. Methoxamine, they increase BP, they have an action on only alpha 1. Phenylephrine, alpha 1, primarily used as a eye drop. So alpha 1 in eye causes mydriasis, dilatation of pupil due to stimulation of alpha present in radial muscles. Isoprenaline is a selective beta 1 receptor agonist. Kothay beta 1 thake? Heart and Jg cell. You have to remember another one thing, the Jg cell. Ephedrine. Now this is an important thing. Ephedrine, pseudoephedrine, phenylephrine. These are mixed type of action. So they are directly stimulate alpha receptor and they can cause also bind and release the storage of noradrenaline. তার মানে কি হলো, একটা যে ডাইরেক্টলি, একটা ইনডাইরেক্টলি। ডাইরেক্টলি মানে কি, অ্যাড্রিনালিন যেমন ডাইরেক্টলি রিসেপ্টরে গিয়ে লাগে, কোন রিসেপ্টরে লাগে অ্যাড্রিনালিন? আলফা 1, আলফা 2, বিটা 1, বিটা 2। নরঅ্যাড্রিনালিন কোথায় লাগে? আলফা 1, আলফা 2, বিটা 1, বিটা 3, no beta 2. Similarly, ephedrine can also bind with the alpha and beta receptor, as well as they can also bind with the storage and release some noradrenaline. So there are two actions. One is direct, one is indirect. Indirect action ta ki hobe? By releasing noradrenaline present in the vesicle of the presynaptic nerve terminals. Clear? So these causes mixed type of action. Direct, indirect, mixed. Clear? There is a term called tachyphylaxis. Tachyphylaxis, what is tachyphylaxis? After giving a drug repeatedly in a short duration, their action is limited or reduced. Clear? So, if the drug is either mixed or indirectly acting means they are not directly bind with the adrenergic receptor, but they bind and release of কি release করে noradrenaline from the storage site. So if we repeatedly use that drug, indirectly used or mixed type, they exhausted this noradrenaline present in the vesicle. So their action will be reduced when it is used repeatedly in a short duration. Their action becomes lesser than the first time. This is called tachyphylaxis. It is occur in কাদের সাথে হয়? Either indirectly acting sympathomimetic or mixed type of sympathomimetics. Amphetamine, methamphetamine, dextroamphetamine, all these acts directly act as well as by releasing neurotransmitter. Their action more prominent for the CNS. For adrenaline, noradrenaline, CNS action is not important. But their substitute like amphetamine, they are as a very important CNS action. And what are the CNS action? Increase alertness, reduce sleep, increase concentration, generalized stimulation, and suppression of the appetite. All these are very important for the student before the examination. So they are used this amphetamine previously just before the examination, but they have very bad side effect. So nowadays it is banned without a prescription. It also helps in respiratory stimulation if some hypnosedative agent is used or poisoning. They can also stimulate the respiratory center. It is a banned drug for nowadays. So CNS action, adrenergic drug with CNS action, name is amphetamine. কি কাজ করে? Increase concentration, increase alertness, reduce sleep, reduce appetite. Clear? They are banned nowadays. They also help in respiratory stimulation for hypnosedative poisoning. Hypnosedative poisoning মানে সিডেটিভ ড্রাগের নাম বলো, হিপনোটিক ড্রাগের নাম বলো, জানো? বেনজোডায়াজিপিন, বারবিচুরেটস, ঠিক আছে? All these are hypnosedative. And their poisoning, they have a role. They doesn't act the similar receptor, but they stimulate the respiratory center, which is depressed by these hypnosedative drugs. Clear? So drug with a CNS effect, drug of adrenergic drug with a CNS effect is amphetamine. Phenphuramine, they reduce the appetite, sedation, loss of libido. These phenphuramine primarily used for the obesity, but it also banned nowadays without a prescription. It is not used. Sibutramine is used for the similar effect, reduce appetite, so in obesity. Next, nasal decongestant. Nasal decongestant drugs are nafzolone, oxymetazoline, xylometazoline. They act in the alpha receptor. Where is this alpha receptor present? In the peripheral vessels, in the mucosa of the nose. So what happened? By stimulating this alpha 1 receptor, there is a less amount of fluid can pass through this vessel to the mucosal third phase. So mucosal edema will be reduced. So that can lead to release this nasal stuffiness. Nasal blockage can be counteracted by the alpha 1 receptor agonist, which can act in the nasal mucosa, namely oxymetazoline, xylometazoline group of drug. Here these drugs primarily used as a nasal spray or nasal drop. So this action is local. This action is local. Salbutamol, tarbutaline, they act on the beta 2. Beta 2 present in the present smooth muscle. Kotaka smooth muscle? Tracheobronchial tree. Bronchial smooth muscle. And they can be used if it is used in bronchial asthma. In case of bronchial asthma. Which route we prefer? Inhalational. If we give a oral salbutamol, what will be the difference between oral salbutamol and inhalational salbutamol? So they stimulate the beta 2 present in the skeletal muscle, resulting into tremor and twitching of the muscle, hands and feet. Then ritodrine, isoxapirin, they stimulate the beta 2 receptor present in the uterus. That can prevent the preterm labor or threatened abortion. So beta 2 agonist is salbutamol, tarbutaline. They are more specific for the beta 2 present in the tracheobronchial tree, whereas ritodrine and isoxapirin is more specific for the beta 2 receptor present in the uterus. Very good. Now clonidine. Clonidine stimulates alpha 2. Alpha 2 present in presynaptic in CNS. Clear? And they can be used, they reduce, noradrenaline reduce, sympathetic outflow will be reduced. So they can used in number 1 as a resistance hypertension, and they can also use as they act CNS in de-addiction of alcohol or morphine. Clonidine is a alpha 2 agonist or antagonist? Agonist. আজকে কোনো অ্যান্টাগনিস্ট নিয়ে কথা বলা হচ্ছে না, অ্যাগনিস্ট, আলফা 2 অ্যাগনিস্ট, বাট ইট রিডিউস রিলিজ অফ noradrenaline and sympathetic outflow by stimulating presynaptic receptor primarily present in the CNS. So though it is a agonist, so one of the sympathetic agonists that can be used in hypertension, that means they can reduce blood pressure by reducing release of noradrenaline as well as sympathetic outflow is clonidine. Clonidine, though it is an agonist, but they can be used in treatment of hypertension. But all other drugs are used in hypotension, cardiogenic shock. Clear? Then D1 receptor agonist present in the coronary, renal and mesenteric fendolopin, that can be used in the increase where there is a requirement of increased blood flow from the heart. Clear? Then where it is used? In hypotensive state. Hypotensive state, so there are, we already discussed about the different shock. বলেছি তো কি কি শক আছে? কার্ডিওজেনিক শক, সেপটিক শক, অ্যানাফাইল্যাকটিক শক। প্রাইমারিলি এই তিনটে নিয়ে আজকে আলোচনা করি। If there is a cardiogenic shock, we can use dobutamine or dopamine. কেন ইউজ করছি? Both these two have a beta 1 action. The cardiogenic shock এ কি হবে? আমাদের our target will be increase cardiac output. For increase in cardiac output, the important receptor is beta 1, and dopamine and dobutamine both can stimulate beta 1. Number 1. Number 2, in anaphylactic shock, which drug we will prefer? In anaphylactic shock, there is a contraction of tracheobronchial smooth muscle along with the mucosal edema. In this case situation, we use adrenaline. We prefer adrenaline because they have both beta 2 action and alpha 1 action. Beta 2 action will relax the tracheobronchial smooth muscle, whereas alpha 1 action will reduce the edema, mucosal edema. Clear? Tale? Cardiogenic shock drug of choice is dobutamine, dopamine. In case of anaphylactic shock, drug of choice is adrenaline. And why? Clear? Third one is in septic shock. In septic shock, there is a leakage of plasma through the vessels which is dilated due to the infection. In this situation, we use noradrenaline. They have no action. Their primary action is on alpha 1 without any beta 2 action. If we give adrenaline, they can also increase leakage due to the stimulation of the beta 2. So we used alpha 1. We used alpha 1 for septic shock. Then next one is with local anesthetic we can use adrenaline. Why? Why we use adrenaline with local anesthetics? Because number one, there is a vasoconstriction, so amount of local anesthetics will be absorbed is less. কারণ vasoconstriction হচ্ছে, so যদি if there is a less amount of local anesthetics absorbed, that means more amount of local anesthetic present in the site of action, duration will be increased. Number one. Number two, less side effect, less systemic side effect, as less amount of local anesthetic can go into the systemic circulation, and there will be less bleeding, so operative site will be clear. So there are 3 points why we use adrenaline along with local anesthetics. In local bleeding like epistaxis and gastric bleeding, we give some noradrenaline soakage in the cotton tissues. Nasal decongestant, how it acts, we already described. Pseudoephedrine can be used in orally or as a nasal drop. Oxymetazoline, xylometazoline. How it acts? It stimulates alpha receptor, alpha 1 receptor, and reduce mucosal edema. In peripheral vascular disease, isoxapurin is used. They stimulate beta 2 and there is a vasodilatation due to beta 2. In hypertension, drug used is clonidine alpha methyl dopa. Alpha methyl dopa is a drug of choice for pregnancy induced hypertension. Clear? Or cardiac arrest, adrenaline is preferred. AV nodal block or cardiac arrest. In central or CNS use, amphetamine is used in pseudo-hypnotic poisoning. Why? Why? They can stimulate respiratory center, which is depressed by the sedative or hypnotic. In narcolepsy, in hyperkinetic children, amphetamine is preferred. In obesity, fenfluramine and sibutramine is preferred because it reduces the appetite. It reduces the appetite. In de-addiction, use is clonidine. Clear? এই পর্যন্ত কি হলো? Pseudo-hypnotic, narcolepsy, hyperkinetic children amphetamine. Then in obesity, sibutramine, fenfluramine. In case of de-addiction, clonidine. So use of clonidine. What are the use of clonidine? কোথায় কোথায় ইউজ করতে পারবো? As a hypertensive, and number 2 as a de-addiction agent. In respiratory, bronchial asthma, beta 2 কি drug use করি? Salbutamol, terbutaline. In ophthalmic, mydriasis, phenylephrine. In glaucoma, apraclonidine, brimonidine. In uterine relaxation, isoxapurin, ritodrine. Hot flashes, we can use some centrally acting adrenaline drug. Now we already discussed what is direct sympathomimetic, indirect and mixed. What is direct? They bind with the either of this receptor, G-coupled protein receptor, and act. In case of indirect, they doesn't bind with that alpha 1, alpha 2, beta 1, beta 2. They bind and release of noradrenaline from the vesicles. Example is tyramine, amphetamine, and they are mixed. Both they can bind with the receptor and stimulate, as well as they can release noradrenaline from the vesicles. They are mixed. Now, next one is, which one causes tachyphylaxis? Which of these drugs can cause tachyphylaxis? Indirectly acting or mixed type of drugs can cause tachyphylaxis. Dobutamine, more selective ionotropic agent. Adrenaline, 0.5 milligram injected promptly IM. It is important. In which route? Intramuscular route. Dose is 0.5 milligram. Where? In case of anaphylactic shock. In case of anaphylactic shock, we are not going for the intravenous or other route. It is given in the intramuscular route, and dose is 0.5 milligram. How it can counter? It relaxes the tracheobronchiality by stimulate the beta 2, as well as by stimulate the alpha 1. They can reduce the mucosal edema. Oral ephedrine can be used in postural hypotension. It can be idiopathic. Postural hypotension means, what is postural hypotension? তুমি বসে আছো, কোনো অসুবিধা নেই, just suddenly stand up and there is a dizziness, vertigo, due to less amount of blood going into the CNS. There is peripheral fluid. In this situation, oral ephedrine is preferred. Adrenaline, when given with local anesthetic, the dilution is 1 in 1 lakh to 1 in 2 lakh. Clear? For IM, 0.5 mg for anaphylactic shock. When it is given with local anesthetic for spinal anesthesia or nerve block, it is 1 in 1 lakh to 1 in 2 lakh. This dilution. And why it is used? Duration of the anesthesia prolonged. Why? Because less amount of the local anesthetic can be go into the systemic circulation, as there is a vasoconstriction. Similarly, systemic toxicity of the local anesthetics will be less. Why? As there is a vasoconstriction, less amount of the drug go into the systemic circulation. And third one is, local bleeding will be less. So the surgical site will be clear, less amount of bleeding. So explain why we give adrenaline with local anesthetics for spinal anesthesia or nerve block. Explain why a 3 point. Duration will be increased. Duration of duration increase of a local anesthetics. Toxicity of local anesthetic will be reduced, and third point, local bleeding will be minimized. When in epistaxis, it gives adrenaline in 1 in 10,000. Dilution, other than adrenaline, phenylephrine and ephedrine also can be given. It can control capillary and arteriolar bleeding, not arterial bleeding. Clear? 1 in 10,000. তাহলে local anesthetic এর সাথে কত dilution? 1 in 1 lakh to 1 in 2 lakh. In case of epistaxis, to control capillary bleeding or arteriolar bleeding, 1 in 10,000. In case of anaphylaxis, 0.5 mg, কোন রুটে? Intramuscular, not intravenous or subcutaneous. Clear? Noradrenaline can be given in 8 milligram, dilute in 100 to 200 ml of normal saline to control gastric erosion or stress-related bleeding. 8 milligram in 100 to 200. Adrenaline গুলো অন্তত মনে রাখতে হবে, ঠিক আছে? 0.5 milligram IM 1 in 1 lakh to 2 lakh for with local anesthetics, and for local bleeding it is 1 in 10,000. For noradrenaline, if 8 milligram in 100 to 200 ml saline. Isoxapurin কোথায় ইউজ হচ্ছে? Certain abortion, or if there is a dysmenorrhea or there is a labor, preterm labor, to reduce that. Dopamine কোথায় কোথায় কোন কোন রিসেপ্টর? ডোপামিন ডি, lowest concentration in dopamine receptor which is present in the renal vasculature, then beta 1, and highest there will be alpha 1 stimulation. Clear? Dobutamine used in increased force of contraction, cardiac force of contraction. কোথায় ইউজ হবে ডোবিউটামিন? কোন টাইপের শকে? Cardiogenic shock. If there is a myocardial infarction, then we can use dobutamine. Ephedrine, it can causes tachyphylaxis. Why there is a tachyphylaxis? Ephedrine, by exhaustion of storage of noradrenaline present in the presynaptic vesicle. Clear? তাহলে এখানে এক্সপ্লেন হয় প্রচুর আছে। কি কি এক্সপ্লেন হয়? Why adrenaline is used with local anesthetics? Why adrenaline is used in anaphylactic shock? Dobutamine in cardiogenic shock, dopamine in the moderate dose. Why moderate dose dopamine is used in cardiogenic shock? Why? Because in the lowest dose they only stimulate D2 receptor present in the renal vasculature. In moderate dose D2 plus alpha 1. The alpha 1 stimulates hole ki hobe? Increase cardiac output. But in the highest dose they also stimulates alpha 1. Alpha 1 hole ki hobe? There will be vasoconstriction, which is not productive in this situation. So moderate dose of dopamine use. Why adrenaline used in anaphylactic shock? Both stimulate beta 2 and alpha 1. Beta 2 relaxes the tracheobronchiality, alpha 1 reduce the mucosal edema. Clear? What are the nasal decongestant? Drugs used in narcolepsy, ADHD, attention deficit hyperkinetic syndrome কি কোন ড্রাগ ইউজ হয়? অ্যামফেটামিন। ওবেসিটিতে কোনটা? ফেনফ্লুরামিন। এগুলো কিন্তু মনে রাখতে হবে। হ্যাঁ, হোয়াট ইজ দ্য ডিফারেন্স ইন রিসেপ্টর লেভেল ফর অ্যাড্রেনালিন এন্ড নরঅ্যাড্রেনালিন? Noradrenaline doesn't have a beta 2 receptor, so they doesn't produce reversal of del. Clear?